now joining us, as you just saw them on television, to discuss Dr. Human Zarenkalk. Dr. Zarenkalk is a board-certified oral and maxillofacial surgeon at Loma Linda University, where he helps train future oral surgeons.
And also with us is Dr. Jivraj. Dr. Jivraj is a prosthodontist. I think that means...
he's an expert.
Yeah, he's puts that...
Full mouth rehabilitation.
Yes, anyway. And he'll tell us what it is. And he's co-author of the textbook, Treatment Planning in Implant Dentistry.
Thank you so much for being here. And let's start with prosthodontist. It's a mouthful, right? No pun intended. But what does a prosthodontist do?
Thank you very much, Elizabeth, Rick, for having us. A prosthodontist, most people don't know what a prosthodontist does. A prosthodontist is really an architect of the mouth. We're the ones who are responsible for fixing extensive problems.
So like dentures.
Dentures.
Do you do dentures?
We specialize in dentures, cosmetic dentistry, dental implants. When a patient really needs more extensive treatment needs, they would come to a prosthodontist, and we'd work with other specialists like oral surgeons to essentially give the patient back what they had.
Okay, and Dr. Z, what was that long word in your name, what you do?
The maxillofacial?
Yes.
Oral maxillofacial surgeons are dentists that have undergone extensive training, extra training on top of dental school to be able to treat all kinds of anomalies and pathologies that have to do with the face and the oral cavity. So basically we do surgery of the face and the oral cavity.
Oh, okay.
And let's talk about now, I think it's important to note that we've got baby boomers right now who are aging, and what's available now in terms of dentistry wasn't available even 10 years ago. So what's new, Dr. Jivraj?
There are many things that are changing, and it's such an exciting time to be in this field. Now, you touched upon baby boomers. Most baby boomers went through an era where they didn't have preventative health, they didn't have advice on how to look after their teeth. And as a result, many of them are now losing their teeth, and their biggest fear is wearing dentures. To have two pieces of plastic move in their mouth, they can't enjoy their food, their quality of life suffers, and today we have a solution for that, which literally can provide them a new smile within a day without teeth which move around in their mouth.
And how does that work? How's that different from what we had 10 years ago?
So if I was to tell you today that, say your teeth were failing, and your dentist said to you, we have to take all of your teeth out, and we have technology today via CAT scan technology and diagnostics whereby we can remove your teeth, place dental implants, and give you fixed permanent teeth that very same day. Literally, you walk in at 8 a.m., and by midday, you'll have a fixed permanent smile.
That's incredible. We're looking right now at some pictures. Explain what we're looking at, please.
Essentially, what you're looking at, this is a lady who came to see us, and she had an upper denture, but she was struggling with her lower teeth. Her lower teeth had decayed, and she really didn't want to wear a lower denture. So, Dr. Zarenkalk had removed her teeth, and why don't you go ahead and...
Yeah, what we see here, Dr. Zarenkalk, to the right.
Right. What we see is that her condition before we did the procedure and what she
Now, are
had.
those real teeth?
To the right, we're not.
To the right, are those...
The plastic ones?
Yeah, well, no, I guess the plastic ones aren't real. So at this point, we're not at the point yet where people can regenerate their own teeth. But as I understand it, maybe some years down the road now, with the way the research is going, they could actually use stem cells to regenerate a person's teeth. So you wouldn't even need dentures or anything like that anymore.
Dental implants, which is what we're looking at there.
You could grow your own teeth.
Well,
now, is that just pie in the sky, doctor? Or
no, there's actually some progress being made on that. And there are institutions that are working on using stem cells to actually regenerate teeth. But meanwhile, until that becomes available to the mass public, we do have options. So you don't have to go without teeth now, even if you're waiting for the stem cell technology to come aboard.
Right. As we talk about dental implants, though, it's a very intricate process. So you obviously want somebody who is an expert. You both teach. Tell us a little bit about the actual process to have dental implants. When I first thought about it, right,
just the thought of it.
Because you think they're going to drill every spot. How many teeth do we have total?
With your wisdom teeth, you'd have 16 teeth per arch.
Per arch.
Yeah.
Okay, so top and bottom.
Yeah.
But when you get dental implants, you don't drill everywhere, do you?
No, you don't have to. That's one of the new advances that we've advanced this, and we've studied it so much that now we can replace all your teeth with minimum number of implants. So it's a lot less traumatic. It's a lot less costly because you're using less and less material that's involved.
Less traumatic, less painful, more efficient. But have people's attitudes changed? or is it still, for most people, a terrifying experience to go to the dentist?
Let me tell you this. If somebody is to lose their teeth, one of the things that they don't know, when they lose their teeth, they lose their bone, and that affects their facial structure, so it ages them dramatically. So as far as pain is concerned, the procedure, which has been pioneered in Europe and is available here, is essentially giving them their teeth back literally in a day. And with the use of dental implants, it preserves their bone, which is dramatic for them. They're able to chew, they're able to eat, they're able to bite into an apple, and their quality of life is phenomenal.
Explain what we're looking at here, because these are implants to the right, from my vantage point anyway.
Essentially, this is a young lady who came to see us with a decayed mouth, and she'd been through some life problems, and she was looking for a solution. So unfortunately for her, her teeth were all removed, and she didn't want to wear dentures. That was one of her main concerns. She said, I'm young, I don't want to have teeth that move around in my mouth. So what you're seeing on the screen is literally what was done in a day. Her teeth were removed, dental implants were placed, and we gave her fixed permanent teeth that very same day.
It is amazing, but it also, you were explaining about the muscles in your mouth, because sometimes over time, if you use, let's say, a denture that's not great, it changes the infrastructure, correct, or no? I mean, how does that, like the overbite, the underbite, how does that play out when you're getting your dental implants placed?
Then what preserves your bone structure, what preserves your muscles in your body is the use of them. And a denture never puts any real pressure on the bone. So you're not preserving your jawbone, you're losing structure, you're losing the muscles. That's why when you look at people that have worn dentures for a long time, they have that collapsed bite, that reverse smile. They have a lot of lines around their lips, and that's because they've lost the bone, all the structure that supports your teeth. And the analogy I use is that if you put a cast on somebody's arm, when you take it off, 8 weeks later, there's no muscle left. It's really skinny. And that's the same thing that happens. That's atrophy. Right. And the same thing happens with your jaws and the facial muscles and everything that's involved.
So I have a question, though, Rick and Elizabeth, because here's what I'm curious about. On the one end of the spectrum, we see the clinic helping the low-income folks get the dental help they need. Right. This seems to be the completely other end of the spectrum. I'm just curious about the costs and what's involved, because those teeth look amazing, but I'm sure you don't have a sliding scale and take dental cal or something like that.
As far as cost is concerned, certainly the costs are up there. But I would tell you, if you look at things over a period of time and what it does to your quality of life, if I was to ask you, if you spent X amount of dollars on something that you're going to use for the next 25, 30, 40 years, and it's going to improve your confidence, it's going to improve your relationships, it's going to give you better job opportunities, give you better health, what price would you put on that?
Now that sounds expensive.
No,
that
and surprisingly, right, it is not that expensive.
Give us a range. The kind of thing we're looking at here. What's the range of what a person pays?
Let me put that in perspective. The best way I can explain this is that all of our patients that we treat, almost all of them, they're not wealthy individuals. These are blue-collar, working individuals that have lost their teeth. And I think for us that have our teeth, to sit there and decide to put a value on that is not really fair, because for them, these folks, I mean, they would do anything to get their teeth back. So to put that in perspective, I mean, most of our patients, say 99% of the patients that we treat are not wealthy individuals. So the price that you pay depends on a number of things, of what the procedure is, what the extent of the procedure that we have to do. But I can tell you that it's affordable for most people. But it isn't inexpensive.
And you talk about your health. I mean, dental care is closely linked to your health. So right, what happens when your teeth start decaying? I mean, we heard in David's piece, the dentists say it's been fatal in some instances. I've heard if you don't take care of an infection or something, it can affect your heart. Can you expand on that?
It certainly can. Now, the mouth is a gateway to the rest of the body, and certainly infections can be fatal if they're not taken care of in an appropriate time manner. Now, when you lose your teeth, there are numerous studies to show that patients cannot chew well enough, they cannot digest their food well enough, they're on more medication for gastrointestinal problems, so their overall health really does suffer. And when you start looking at the overall cost of healthcare in this country, that has a huge impact, but we're not looking at it from ground up here.
I see. We have some more pictures here. What are we looking at, Dr. Zarenkalk?
Okay. This is an individual that obviously is missing a few teeth on on her right side, and you can see the actual implants. Those are the abutments that are on the implants. The implants are actually in the bone underneath the gums. And Dr. Jivraj has made a prosthetic or made some teeth that are screwed into the implants. So the implants are supporting the fake teeth that you see on the picture on the right
So
side.
it's all on
Help
four?
me again now. I'm going to try
Right.
one more time. What would that cost roughly? Come on, just give us a
range,
number.
just a range.
In a ballpark, that would cost in the region of about $8,000 to $10,000.
Okay.
And when you talk about the actual implant, so what is this procedure all on four? Is that so there's 4 drillings?
All right, so the all-on-4 has really revolutionized the way we treat patients who have dentures. Many, many years ago, most of these patients that haven't had teeth, they used to lose bone, and if you went to an oral surgeon, the oral surgeon would tell you that you need to have bone grafts, we'd need to open your hip, take you to the OR, and it would be a 2-year process to get teeth that were fixed in the patient's mouth.
So long.
The all-on-4 process, 4 implants, same day, same teeth, backed by years of research.
Well, you know, you're talking about the advances that are being made in the type of thing that you work with, teeth, dentures, and that. A lot of the other things that are going on in the dentist's office have just changed within the last, the last 10 years or so. How about this digital, the digital scanning, digital photography? I mean,
The
now you go
cosmetic
in,
imaging type
the imaging, the digital imaging that goes on. That's relatively new, and how is that affecting dental health?
There are so many things that have happened. Digital imaging, for example. You could come into the office and we could take some photographs and digitally image your smile to give you an idea of what you're going to look like at the end before we start. So before you make a commitment, you know exactly where you're headed, beginning with the end in mind. We have technology whereby we don't need to take those impressions anymore, where you have to put an impression in your mouth. We can literally scan the tooth, and we have CAD/CAM milling machines which mill the caps or the crowns, you may call them, and we can put them in your mouth literally within 45 minutes to an hour.
And who's a good candidate? Because I think that you talked about baby boomers, and at some point there can be a lot of health issues as well. Maybe there's a diabetic condition, hypertension. What if someone needs anesthesia, maybe to go under? Is it under general anesthesia, the procedure?
No, all the procedures, all the patients that you've shown here, all the patients are treated under local anesthesia with very mild sedation. We actually find it easier to treat these patients when essentially they're awake but comfortable. So I always compare it to the kind of anesthesia you get for a colonoscopy or something like that, where people are familiar with.
How old is too old?
The age is not a factor. Age is not a limit. We've done the all-on-4 procedure or the full mouth reconstruction as old as 92 years old.
92?
92-year-old.
We've got time. We've got time.
How long will it be before no longer when I go into the dentist do I get strapped down with that giant
that
lead
noise.
blanket and the nurse is taking pictures and running out of the room, which makes me feel real good that I'm being bombarded with radiation. Is that going to go away one of these days?
No, I think it's already gone away. We have digital radiography whereby the radiation dose is 100 times less than what it used to be. Now, the aprons are obviously for your benefit. Any amount of radiation which can be reduced would be great. But digital radiography has really made things much safer.
So if I want to be macho, I can say, I don't need that. Just bring it on, right?
You can if you want.
Okay. Now, we've been talking about cost. I'm going to ask a very simple, maybe a dumb question. Is dental work covered under Obamacare? Or is it just insurance?
Children's dental care is covered under Obamacare, or they're supposed to cover it. I'm not sure the extent of it, though. They do actually cover, but the adult dental care is still not covered under any medical insurance unless it's cancer-related or trauma-related, some of them.
Now, why is that? Did you guys not do a good job of lobbying Congress? Or, yeah.
No, I think we did a good job lobbying Congress not to cover it.
Okay.
Well, Amy, it's a benefit for them because the insurance pays you, 1 cent on the dollar.
Exactly.
They don't take insurance.
Right.
They get reimbursed very well. So actually, it is a benefit to them.
So you should floss. You should definitely brush your teeth. I mean, I'm always curious. I always ask dentists, how many times do you actually floss and wash, brush your teeth a day? But I also wanted to ask you about these Hollywood smiles. I mean, we are in Los Angeles, and the reality is you see so many actors that are up there in age, and they have a perfect smile. Is that what we're looking at? A lot of great dental implants?
The Hollywood smiles are mostly veneers, and essentially these are facings which change the shape of the teeth and make them look nicer, and they last about 10 to
Elizabeth,
12
I thought
years.
that's what you had.
I need a lot of help.
your
I have
teeth.
these are veneers. I wish, Rick. No, you know, I'm scared actually. But these are veneers right here, and look at that. What a difference! Because once you lose your enamel, and I learned this. Tell me if this is true. You can tell me I'm wrong right now on television. Is it true that really your natural color of the tooth is somewhat yellow?
Oh, now, let me show you like exactly what's happening on the screen there.
Yeah.
Now what you're seeing is a lady who's had veneers done. Back in the day, these teeth all would have been crowned, and the difference between a crown and a veneer is with a crown, the whole tooth is cut down. Today we are much more conservative. We are trying to preserve as much tooth as possible and bond to it rather than cutting it down.
Okay.
So bond to it means what?
Meaning that we actually take a piece of porcelain and we stick it to the tooth rather than cutting the tooth down and cementing a cap on.
Okay, because once you lose your enamel, it's gone forever. Is that
Yes,
right?
we want to try and be minimally invasive.
And it strengthens the teeth instead
Okay.
of cutting it down. Instead of carving it down to a little nubbin to put the crown on, now you're just removing a small layer and bonding to it, or gluing to it, so strengthen the tooth actually.
Right. Do you use a hard toothbrush, medium, or soft? What do you recommend? Seriously, we have an oral surgeon and a prosthodontist. What do you recommend?
I always recommend patients get as much help as they can, and I would normally recommend an electric toothbrush.
Really?
Yes.
Is it better than the manual, really?
Well, it depends on how much effort
Well, how
you
about
put
now at
into it.
Costco, I get these toothbrushes that have a little battery in them, and they vibrate.
Is that good?
No, they're great. They're
yeah.
great.
And
How
what
long
about
should you be for?
You know, I think anything whatever works for you to get.
Yeah,
in
and how about the
clean
little
is a-
plastic picks? I use them. I think everybody uses those now. Those are great, right? I mean,
I think it's an individual thing. Whatever works for you, as long as you can get between your teeth, and whatever works with your manual dexterity level is the best for you.
So you brush how many times? 2 times a day?
No comment.
No comment. Ah!
3 times.
3 times a day. Wow. Okay, now I know why I have problems. Anyway. Boy. Okay, that's all the time that we have for now. But thank you all so much for being here. Our special guests tonight have been Dr. Hooman Zarenkelk and Dr. Saj Jivraj.
and of course, our own David Nazar.
You've heard from us, and now we'd love to hear from you. So please go to the studio.